Mr. Crow, good morning. My name is Matt Jernigan, and I'll be your student nurse today. Can you please provide me with your full name, your date of birth, and your MRN? While the patient does that, I'll make sure I wash my hands with soap and water and don gloves. Mr. Crow, do you have any allergies to food, medication, the environment, latex, or tape? Okay. Information you provided me with matches the information in your chart. Mr. Crow, I see your vital signs here in your chart. Your heart rate is 120/80, which is normal. Respiratory rate is 15 breaths per minute, which is normal. Heart rate is 70 beats per minute, which is normal. Oxygen saturation is 99%, which is normal. And your temperature is 98 degrees, which is normal. Mr. Crow, can you please tell me a little bit more about the pain that you're having in your back? Can you please tell me about the onset of that pain? Can you please tell me about the location exactly where that pain is happening? How long has that pain been going on for? How would you characterize your pain? What aggravates that pain? What makes it better? Have you tried any treatments? On a scale from 0 to 10, how would you rate your pain, 10 being the worst pain imaginable and 0 being no pain at all? Patient exhibits no signs of distress. Patient is oriented to person, time, and place. Also, if there were any tubing present for oxygen, for IV lines, or a catheter was present, I would assess each and all to make sure that they were functioning normally, as ordered, and to make sure that there were no risks or hazards present to the patient in terms of tripping hazards or skin breakdown, anything in that sort of area. Okay, Mr. Crow, I'm going to take a look at your hair, skin, and nails. I'm going to begin by feeling your scalp. Okay, the scalp is normocephalic. There's no hair loss present here. I'm going to take a look at your skin. There's no lesions or rashes. No lesions or rashes here either. I'm going to assess your capillary refill. Okay. Cap refill is less than 3 seconds in each extremity. I'm going to take a look at your eyes, Mr. Crow. Also, after touching the patient's feet, make sure I perform hand hygiene. Okay, please look at my pen. Okay, pupils are equal, round, reactive to light. Mr. Crow, please look at the apple back there, not look at my finger. Okay, pupils are accommodating. Okay, your sclera is white in your eyes. Conjunctiva is pink. Eyebrows are symmetrical. Mr. Crow, can you smile for me? Okay, smile is symmetrical. Take a look at your nose. Okay, no drainage is present. Also noted on the tongue. There are no abnormalities in color or no lesions present. Take a look at your ear. Would assess the outside of your ears for any lesions or abnormalities. I would take an otoscope and look inside and assess for a pearly gray, hopefully looking for a pearly gray, what we want. Okay, Mr. Crow, I'm going to take a look at your respiratory system, assessing your intercostal muscles and your diaphragm. Okay, no extra work is present. These muscles, and that's in line with your normal respiratory rate of 15 breaths per minute and your heart rate, which was 70 beats per minute. No abnormalities noted there. Okay, Mr. Crow, I have you move so I can listen to your lungs and your back. Okay, I'm going to utilize the diaphragm, and I'm going to listen for utilizing a Greek key pattern. Okay, so I'm going to have you take a deep breath in, please. Exhale, deep breath in, 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 exhale. Okay, so I'm going to let you catch your breath. Let you take a break. Okay. breathing rate and rhythm were normal. No adventitious sounds were heard. Okay, Mr. Crow, I'm going to take a look at your cardiac system now. We're going to begin by inspecting your jugular veins for any distension at 45 degrees. Take a look at your precordium on your heart. Okay, now I'm going to go ahead and palpate carotids one at a time. Make sure there's no thrills present. I'm going to palpate your PMI. Make sure there's no lifts or heaves. Okay, I'm going to feel for your pulses here, and your radial pulse and your dorsal-pedalis pulse. Radial and dorsal-pedalis pulse here. Okay, pulse is normal +3. Perform hand hygiene after touching the patient's foot or feet. Okay, Mr. Crow, I'm going to go ahead and take a listen to your heart. Also going to listen to your carotids. I'm going to utilize the bell to listen to the carotids. There's no bruits present here. Okay, no bruits present here. I'm going to utilize the bell and the diaphragm to listen to the patient's heart. I'm going to begin at the right sternal border, the aortic, which is in the second intercostal space. After I do that, I'm going to progress to the left sternal border and the second intercostal space, which is the pulmonic. I'm going to progress down to Erb's point, which is the third intercostal space, the left sternal border. I'm going to progress down the left sternal border to the fourth intercostal space, which is the tricuspid. And then I'm going to move to the midclavicular line of this space, and I'm going to listen to the fifth intercostal space. I'm going to listen to the mitral area. I'm going to note the rate and the rhythm. In the case for Mr. Crow's rate and rhythm were normal and consistent with his normal respiratory rate of 15 breaths per minute and his heart rate of 70 beats per minute. The rate and rhythm were normal. There were no adventitious sounds, heard no S3, no S4, no murmurs. Okay, Mr. Crow, I'm going to have you lie down so that we can assess your GI system. Mr. Crow, could you please tell me if you've had any changes to your diet recently, and if that has contributed to it, or if that either has contributed or if it's otherwise any cramping or diarrhea, constipation, any changes in your pooping pattern, any trouble pooping? Okay, I'm going to go ahead and begin by inspecting the abdomen. Noted here that the abdomen in the patient is flat. I'm going to go ahead and listen to the abdomen. I'm going to use my, I'm going to utilize my bell, and I'm going to listen to the aortic. And then I'm going to use my diaphragm to listen to all four areas, and I would listen to each area for up to 5 minutes, if no sounds were heard. Okay, and then I would progress to percussion. Then I would lightly palpate each area, and then I would go ahead and do deep palpation in the area. Okay, Mr. Crow, I'm going to have you sit up. Mr. Crow, can you please tell me about your urinary system? Like, have you had any trouble urinating lately? Have you noticed any changes, any problems with peeing? Any pain, discomfort, changes in flow, any abnormalities? I would also assess to make sure that the patient had proper intake and output of urine. Hey, Mr. Crow, have you had any loss of feeling in your extremities? Any tingling sensations? Okay, I'm going to have you squeeze my fingers and push down on my hand. Okay, squeeze my fingers, push down on my hand. Okay, muscle strength is normal. I would also perform hand hygiene after touching the patient's foot. Mr. Crow, is there anything else that I can do for you today? Okay. I would also make sure that the patient's call bell was in reach and the patient knew how to use the call bell. I would make sure that the rails were up and the bed was in the lower position, and that there were no hazards present for the patient. Well, okay. No questions. I'll be right around the corner. If you need anything, please let me know.